Mozambique races to contain 1,000 cholera cases. Beira, Mozambique. Mozambican and international health workers raced Monday to contain a cholera outbreak in the cyclone-hit city of Beira and surrounding areas, where the number of cases has jumped to more than 1,000. One person has died of cholera, while 97 patients remain in treatment centers, with the others released, Mozambique's health director Hussein Issa announced. The new figures are, UN spokesman Stefan Dujarric said there is also a high risk of the spread of infectious diseases including those caused by insects like mosquitoes, with 276 malaria cases also reported in cyclone-affected areas. The overall cyclone death toll in Mozambique has risen to 518. With 250, Dujarric said more than 140,000 people in Mozambique are sheltering in 161 sites, including schools and community centers. He said 11 emergency treatment centers for cholera victims have been established in Beira and other locations and 9 are operational. Mozambican workers have restored clean tap water to parts of Beira, a city of 500,000, although large areas of the urban center still don't have access to sanitary water. David Whitewick, the World Health Organization's team leader in Beira, told the Associated Press while visiting a water treatment center. More than 2 weeks after the cyclone hit Beira and swept across central Mozambique, about 98,000 people are in camps for displaced and living. Cholera. In addition to Mozambican medics, health workers from Portugal, Denmark, Italy, and China are helping respond to the crisis. Sanitary water points and latrines are being constructed throughout Beira by the International Federation of the Red Cross, which has also established a field clinic in Macaongo, is constructing a field hospital in Anamatanda and distributing relief supplies to 800 in Buzet, said the group's spokeswoman, Janice Sweeney. Cases of cholera, an acute diarrheal disease, have risen dramatically since the first 5 cases were confirmed last week. Cholera is spread. The U.S. military joined the international humanitarian aid efforts to Mozambique by airlifting food and relief supplies from South Africa. Round-the-clock flights are delivering supplies from the UN World Food Programme. He said the commodities airlifted from Durban were from the World Food Programme's internal stock including rice, dried peas, and vegetable oil. This, as health responders stress the need for better disease surveillance, the United Nations Deputy Humanitarian Coordinator in Mozambique, Sebastian Rhodes Stampa, has said all cases of diarrhea are being treated as though they are cholera. Cholera is endemic to the region, and it. Doctors Without Borders has said other suspected cholera cases have been reported outside Beira in the badly hit areas of Buzet, Tika and Anamatanda, but the chance of spread in rural areas is smaller because people are more dispersed. Mozambican officials have said Cyclone Eve destroyed more than 50 health centers in the region, complicating response efforts. The United Nations has said some 1.8 million people need urgent help across central Mozambique's Southern, largely rural region. The UN Economic and Andrew Meldrum contributed to this story from Johannesburg, and Edith M. Lederer contributed from the United Nations. Follow Africa News @
Raindrops, truck top, smoking, no cooking, the hot, fucking on your bitch, yeah, that.